Even as Election Day is almost underway, the coronavirus pandemic is still at the forefront of most Americans' minds. The country's continually broken records this week alone for the number of coronavirus cases reported in a day. Right now, there are more than 9.2 million confirmed infections in the United States, and more than 232,000 people have lost their lives. Now, the surge in cases is being seen not just here, but around the globe. Countries in Europe are once again shutting down. Just yesterday, the United Kingdom reached 1 million cases, leading Prime Minister Boris Johnson to declare a nationwide lockdown set to last at least a month. Meanwhile, back here, 42 states are seeing increases in COVID cases, yet there are no signs of any impending lockdowns as far as we know. That may change later today. In Pennsylvania, where I am right now, we're clocking more than 2,000 positive cases for the 5th consecutive day. A new Pew Research poll once again highlighting COVID-19's racial divide in this city. Happens across the country, but in this city, this research shows that coronavirus has affected people of color and working class folks the most. In Philadelphia, quote, only 12% of white Philadelphians know someone who has died from coronavirus, but for Black and Hispanic residents, that number is 3 times higher. Joining me right now is Dr. Ayla Stanford. She is a pediatric and general surgeon here in the Philadelphia area. She's the founder of both Real Concierge Medicine and of the Black Doctors COVID-19 Consortium, which provides coronavirus testing for at-risk communities. And before I talk to you about this, I just want to indicate what a big deal this is. You are named one of the 76 most influential people of 2020 in Philadelphia, in PR Week in Philadelphia. 76 being a uniquely relevant number in Philadelphia because 1776. But you found that Black residents were not getting access to testing and were not getting tested. So you sort of said to people, I'll figure this out.
That's right.
We're going to get you tested. I'm going to worry about the payment. You're going to figure out ways that people get this paid for. What did you do and how did it work out?
So basically, I'm born and raised in Philly. People were calling me, Ayla, I can't get tested. I have symptoms. I showed up. I didn't have a script. They turned me away. I was less than 65. They turned me away. The copay was too high. They turned me away. I had a state issue. I didn't have a state issued ID. I drove or I walked and it was only drive up. And there were all these reasons and excuses. So in essence, I created a barrier-free program that you could get no-cost testing. I partnered with LabCorp to get the FDA-approved testing kits, and I said, whoever can't afford it, you're going to bill me, and I'm going to figure it out later, because you're not going to die for a test that costs $200.
I'm still hearing from people who echo what the president has been saying, and that is the reason we have as many cases as we have in the United States is because we test that much.
So, yeah, absolutely false. Increased testing does not equate to increased hospitalizations, increased people on a ventilator, and increased deaths. It doesn't add up. The hospitalizations are going up. People are getting sick. 1 in 10 right now, as we test, have coronavirus. That is not because you're increased testing when they also need to be treated and sometimes don't have access to treatment available.
And by the way, that doesn't apply to anything else in life. If you're looking for breast cancer or you're looking for pregnancy, you can't do it without testing.
That is absolutely right. And when there's no cure, the most important thing we have is testing and contact tracing. And that is still not uniformly available to every resident in the United States, in particular the African-American community and Latinx folks. Still, 8 months later, everyone who needs a test cannot get a test.
So this may be a good example for us to be thinking about how to deal with health care beyond coronavirus or in the next presidential administration, because what you just said about coronavirus access to testing applies to a lot of things with those groups, with people of color, with African Americans, with Hispanics, and with poor working people.
Correct.
Or poor people who aren't working.
That's right. And having health insurance is only part of it. It's also when you show up with insurance that you treat that person with empathy and with respect. You understand from whence they came, so you know best how to treat them. You don't treat them with your own implicit bias. You get to know what impediments they may have to getting to your appointment. So just having health insurance is only part of it. As healthcare providers, we need to do better to understand the people whom we're serving.
What do you think about the trajectory of this infection? The fact that we've been getting more infections, we're seeing even in places in the world where they've done a better job of mitigation because they mandate masks and things like that and social gatherings, and yet we're still seeing this increase. Do you see, Dr. Fauci said we're in for a lot more hurt in the coming months. Do you agree with that?
I agree with it wholeheartedly, because what has to happen is behavior needs to change, which every medical person knows is the hardest thing to change. COVID could stop with every one of us if we wore a mask, we socially distanced, we washed our hands, we stayed away from these gatherings. It could stop, but instead we have to wait for a vaccine that hasn't been through phase 3, that's not going to be available for children right away, and that everyone is not going to be able to get immediately. So it's on us to change, flatten the curve, get to containment levels. And Fauci is saying it may double from 230,000 to 460,000 by February, because Americans need to do better. We need to accept the responsibility and know that the power is within us to decrease these levels.
Dr. Stanford, thank you for joining me this morning. Thank you for coming out to spend time with us. I do know your practice is just down the road. So
yes, I love Philly.
Thank you for being here.
Right,
Dr. Ayla Stanford is a pediatric and general surgeon here in the Philadelphia area, working here in West Philly, actually, and the founder of Black Doctors COVID-19 Consortium.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.